Colon cancer screening options. This video is about a part of your body called the colon and 2 special tests you can get to make sure your colon is healthy. They are called a colonoscopy and a FIT test. Please watch the whole video so you can learn about both tests. The colon is part of your digestive system that helps break down food for your body to use and helps move food waste out of your body by pooping. There is a type of cancer that can grow in the colon. Colon cancer is the 3rd most common cancer in the world. Colon cancer starts when small bumps called polyps grow in the rectum, the butt, or colon. Most of the polyps do not cause cancer, but some can turn into cancer if a doctor doesn't remove them. Polyps do not usually cause symptoms, so you cannot know if they are there without getting special tests. A special test to look for cancer is called a cancer screening. Colon cancer screening lets your doctor see if there is a problem early, so they can give you treatment, prevent the cancer from growing, and help you stay healthy. When colon cancer is found and treated early, you have a very good chance of recovering fully and living a long and healthy life. You should start getting colon cancer screenings around age 45, or earlier if your doctor recommends it. There are a few types of screenings for colon cancer. Talk to your doctor about which one is best for you. The first type of screening is called a colonoscopy, and it happens at the hospital. You will need to take the day off from work for this test. During the colonoscopy, a doctor will put a long, thin, flexible tube with a tiny camera at the tip into your rectum. The camera lets them see the inside of your entire colon. If they see any polyps, they will remove them. Before the colonoscopy begins, a doctor will give you medicine called anesthesia that will make you very relaxed and sometimes sleepy, so that you don't feel any pain or discomfort during the colonoscopy. Because of this medicine, you will need someone to take you home from the hospital. You must not drive after the colonoscopy. You will start preparing for the colonoscopy 2 days before your appointment. The goal of preparing for a colonoscopy is to completely empty all the food and poop from your colon so that the doctor can clearly see your colon with the camera. Your doctor will give you instructions about when to stop eating solid foods and which liquids are okay to drink. Your doctor will prescribe a special liquid for you to drink the day before the colonoscopy that will make you poop a lot to empty your colon. It is very important to follow the preparation instructions your doctor gives you. If you don't, your appointment may be canceled after you arrive at the hospital. Ask questions to make sure you understand the instructions. After your colonoscopy, the doctor will tell you the results and when you need to get another colonoscopy. If they didn't see any problems, you may not need another colonoscopy for 10 years. Most health insurance companies help pay for colonoscopies, but you should check with your health insurance before getting one. Call the number on the back of your insurance card to ask questions about cost. Ask for an interpreter if you need one. Another type of colon cancer screening test is done at home every year. There are different tests available, but this video is about the FIT test. It involves collecting a sample of your poop and mailing it to a lab to test for signs of possible colon cancer. You will receive a FIT test kit from your doctor or the lab. The kit will have a special paper, a tube with a small probe inside, a white pad, a plastic bag, and an envelope. You will need to write your name, birth date, and the date that you do the test on the tube. Ask for help if you need help writing in English. When you feel ready to poop, pee first if you have to go, and then flush the toilet. Then unfold and place the paper on top of the water in the toilet bowl and poop onto it. Before the paper has time to sink into the water, use the probe to poke the poop so that a small amount of poop covers the end of the probe. You only need to collect a small amount of poop, just enough to cover the end of the probe. Then put the probe back into the tube and close the top tightly. You can flush the paper and poop down the toilet. Make sure there is no poop on the outside of the tube. Wrap the white pad around the tube and put it inside the plastic bag. If your kit includes a mailing envelope, put the bag inside it. The address will be on the envelope. Make sure there is a stamp. You should bring it to the post office as soon as possible. Sometimes you will be asked to bring the test back to the lab or the doctor's office instead of mailing it. When you receive the test kit, remember to ask questions to make sure you know what to do. Your doctor will receive the test results and talk to you about them. If the test shows that there are signs of possible colon cancer, you will need to have a colonoscopy so your doctor can get more information. If your doctor asked you to do a colon cancer screening test, but you couldn't do it or decided not to do it, make sure to tell your doctor. Talk to your doctor about getting a colon cancer screening test and ask them which test is right for you.